Hello, good evening, everyone. Welcome to our Limi Hospital Friday webinar. Um, my name is Dr.Obi. Today we'll be discussing a very interesting topic, infertility and IVF. Here with me is my senior colleague.
I'm Dr. Ogoke. You're welcome. I'm a consultant in the Department of Obstetrics and Gynecology, Limi Hospital. We will be talking about infertility today.
Okay, so for those who are still joining in, kindly give us a thumbs up, say hello, say hi when you come in so we'll see you. Thank you once again for joining. I know you've had a long day. It's Friday. We are waiting for the weekend. Um, just say hi, say hello to us. If you have questions along the line, just put your questions in the comment section, okay? Okay, so IVF, infertility.
We better will start with infertility, what it is. I think everybody that is part of this forum would want to know what infertility is. It's important for us to note that infertility is a global problem because infertility is found everywhere in the world. And, there have been so many reports on the distribution or the incidence of infertility. But averagely, it's estimated that about 10% of couples have fertility problems. And the figure is even more in our environment, is even more in Africa, and worse in sub-Saharan Africa, where higher incidents have been reported. And even in Nigeria, some reports show that in Enugu, UNTH reports up to 12%, and in FMC Azari reports of about 23%, and Sokoto Usman Danfodio University Teaching Hospital, some studies there reported about another 12%, and in Lagos University Teaching Hospital, about 26%. So you can see infertility is with us and we bear a greater burden because if the average worldwide is about 9 to 10%, and we are having reports of 12%, 20 something percent, so it means that infertility is something we should take seriously in this part of the world and in Nigeria. And WHO have tried to define infertility because, generally speaking, everybody would say infertility is the inability of a couple once you don't have a child, you are infertile. But WHO have decided to modify that definition or come up with a general standpoint on which a doctor can say this couple this couple have infertility. And this studies was based on the findings. This definition was based on the findings that if you have healthy couples stay together and have adequate sexual exposure, only about 25% will be able to achieve pregnancy without help in less than 6 months. And between 6 months to 1 year, you have up to 60% or a little above that achieving pregnancy. And as from 12 months to 18 months, you have close to 90%. So, based on these findings from a large population studies, WHO have come out with a definition, that a unified definition that says that infertility is the inability of a couple to achieve pregnancy after 12 months of adequate adequate unprotected sexual intercourse. But the question is, considering that definition, one would say you don't have to go to hospital, you don't have to seek help, even with Limi Hospital, until it's 12 months. But the looking only at that definition, one would ask again in another form, the statement I just made, one can say it in another form. Are there conditions where a couple need to seek help before 12 months? The answer is yes. And such conditions will include if the female partner is above 35 years, you will see in as the discussion progresses the role of age and infertility and how age affects fertility in even both males and females. So if the female partner is above 35 years and they have been trying for more than 6 months, that couple should seek help. And for some couple in which either or both partners know that they have fertility problems even before that marriage was contracted, they should not wait for 12 months before they seek help. And then in other situations in which the female partner is known to have conditions like menstrual disorders like polycystic ovarian syndrome and then um, endometriosis and other fertility problems even before marriage, they or even when and other fertility problems even before marriage, that couple should seek help before 12 months. And then if the female partner is known to have pelvic inflammatory disease, the couple should still seek help before 12 months. And in conditions in which couple is receiving cancer treatment
Yes.
and have other medical conditions that can affect fertility like diabetes, thyroid disorders, and so
Hypertension,
on.
even depression.
Even um, severe hypertension, in which the drug that is being used can affect fertility. Such couples should are advised to seek help before 12 months of the marriage.
That's very interesting. For those who are still joining in, please, we're talking about infertility. And you give us a thumbs up, add your questions in the comment section. We're here to answer all of them, okay? Um, yes, considering the infertility, I know that in our environment, we really, really, there's this stigma that comes with a woman who is not able to conceive. And the idea that when a couple cannot conceive, it is the woman's fault, especially in Africa. I know I'm not lying about this. It is true. Women are the ones who go to church more to pray about having children than the men. The men just feel that, oh, they are okay. If they are not having children, it is definitely the woman's fault.
Okay, thank you, Dr. B, for pointing out that. But for us to understand where the problems of infertility originates, whether it's the male or the female, it will be very important for us to first of all understand or ask ourselves what are the prerequisites for pregnancy to be achieved. And the prerequisites for pregnancy to be achieved is one, the male sex cell should be should come together with the female should come together with the female sex cell in a healthy, natural or unnatural environment. Okay, let me explain that statement. I mean, the sperm should be that is the male sex cell. The sperm should be what? Healthy and adequately introduced into the female genital organ. Or in the case of in vitro fertilization or assisted reproduction, it should be produced and be subjected to certain favorable conditions for fertilization to occur. So a healthy sperm must be produced. And two, a healthy egg must be released. That tells us that ovulation must occur. And then the coming together must be in a favorable environment, either in the female genitalia or in the favorable conditions in the laboratory outside in cases of assisted reproductive technology. Bearing this in mind, one would know that the prime person to investigate in infertility, where seeking for the problem of infertility starts from, is probing into what is the source of this sex cell. Remember the requirements: male sex cell, female sex cell, and then healthy environment, which is the tube in the condition in the natural setting, and then in the laboratory, and favorable incubators in cases of assisted reproduction. And then there must also be what? A healthy and a favorable uterine environment. So, in looking for the causes or seeking where the problem originates, one has to look at the source of the male sex cell, and then ovulation or the source of the female sex cell, and then should also look at the where the fertilization is meant to occur naturally, which is the fallopian tube, the condition of the fallopian tube, and then favorable uterine environment. So there are causes in males. Causes in males include, when a male has some of the medical conditions that affect sexual function, like diabetes mellitus and other um, congenital genetic abnormalities, mm, other genetic abnormalities like Klinefelter syndrome, where where the male may not even be producing, the male sex cell, which is the spermatozoa, and then conditions that like infections that affect the testis, which is the primary organ where spermatogenesis or production of the male sex cell takes place. And then where this male sex cell is produced, it has to be what released. So there is a tract. So, that tract, problems with that tract from trauma, from infections, and from other, diseases like cystic fibrosis that can affect the transportation of the male sex cell to the external, to the external genitalia, and then into the female genital tract. So problems like this, account for what we call male factor infertility. So the prime thing in infertility, first we talk about the male factor. And from reports from WHO and worldwide has shown that male factor infertility the male factor alone account for 40 to 50% of infertility. So it is totally wrong to say that every infertility is the fault of the female. No, that's not wrong. That is completely, absolutely wrong. Then in the female, you look at ovulatory factors. Is this egg being produced? Does the female have a healthy ovaries? And then these hormones that play a role in the maturation and release of the eggs, what are their values? What are their levels? Are they at the normal levels to favor ovulation? So the source of the female sex cell. So ovulatory disorders can also be a cause of infertility. And then primary ovarian diseases can also be a cause of infertility. And then you look at the tubes, you look at the fallopian tube, which I said earlier is the natural site for fertilization. That's the coming together and fusion of the male and the female sex cell. So problems like infections that can damage the tube, and then when pelvic surgeries that cause adhesions that can make the tubes lose their function, or anything that cause discontinuity in the patency of the tubes can also, and functionality of the tubes can cause infertility. Then you look at the receptacle or where the pregnancy has to develop, which is the uterus itself. So there should be a healthy, receptive uterine environment. And problems that are associated with infertility, in problems of the uterus that are associated with infertility will include um, adenomyosis and you know severe infections causing severe infections, endometritis, and then Asherman syndrome leading to uterine synechia or intra what somebody can refer to as intrauterine adhesions. You know, taking away the that receptivity of the endometrium and even affecting the menstrual cycle of the woman. So if the causes of the infertility are approached in this way, you find out that everybody has a role or has a cut or has a share the couple. And then let me also quickly state that I said male infertility accounts for 40 to 50%, and then female infertility, which is these ones I just talked about, relating to the ovary, the tube, and the uterus itself, account for 40%. And then in investigating the couple, you find out that where conditions in which you see problems in both the male and the female account for about 10% of infertility.
So at least we now know that everybody has, a part to play in producing a child, okay, in conceiving. So it takes the male and the female gametes to fuse in a healthy environment. So you have to, probe each provider of each, gamete. For those who are still joining, please give us a thumbs up. You're welcome. You're welcome. We're talking about infertility, and this is Limi Hospital. Okay. Um, so if you have any questions, you can put them in the comment section as we go along. All right. So there are other um, okay. There are other things that people might think can cause infertility. For example, hyperthyroidism, and then you know, especially hyperthyroidism, can that cause infertility?
Okay, generally, I have been, mentioning medical
Yes.
conditions in the course of our discussion. The truth is, some medical conditions actually cause infertility or actually are associated with so many cases of infertility, both in the males and in the females. I've mentioned diabetes. I also mentioned hyperthyroidism. But in the females, hyperthyroidism is associated with serious menstrual disorders and ovulatory dysfunction, leading to what? Inability to release the eggs and even impairs the sexual activity or the coming together of the male and female, thereby causing infertility. So these are some of the. There are other ways, even in the treatment itself. Some of the drugs used for treatment of hyperthyroidism affect fertility. So there are other ways, but these are, to mention, but a few ways in which hyperthyroidism can cause infertility.
And we know that hyperthyroidism is a
And endocrine.
an endocrine disorder where the thyroid hormone is produced at a very high amount. Basically, the thyroid hormone is very, very, very important in metabolism. It's in charge of almost everything that goes on in the body. So ovulation, many things, metabolisms of um, glucose, protein, fats, everything. So when you have an excess production of this hormone, it can affect the woman's ovulation as well. Okay, and that will cause infertility. Okay. Another thing is stress. We hear, people saying stress because the person is stressed, they are not able to conceive. Do you think that is correct?
I don't personally, I don't think, yeah, stress may not have a direct cause and effect relationship with infertility. That's,
Thank you.
this statement should be in quote. But stress has a lot of effect on, on especially both the males and the female. In the males, it's associated with some degree of sexual dysfunction, can even lead to depression, and then, in states of, in stressful conditions or in stressful states, the male tends to, not be interested in the sexual act and then can develop some, sexual dysfunction, lead to, which can be erectile dysfunction, and then, you know, erectile dysfunction, and then refusal to even indulge in the act. But in the females, in females, um, stress in females is associated with, a good number of cases of ovulatory dysfunction or anovulation itself. So stress affects, the ovulatory function of a woman and can lead to, even the menstrual stress is associated with menstrual disorders, and that is the mechanism of stress causing menstrual disorders. That's stress leading to an ovulation, which is, you know, the inability of the ovaries to release the female sex cell, which is the ovum or egg.
Alright. But would we say that it's going to be listed as one of the top causes?
No,
It's not.
you won't list. Like I said earlier, it doesn't have a direct cause and effect relationship, but it can be associated with infertility.
Okay, so we're still live. Limi Hospital, join us. Welcome, welcome all those that are joining us. Keep your questions coming. Keep your questions coming. Say hello. Give a thumbs up if you can see us. If you're watching live, you can also tell us where you're watching from. If you're in Abuja, if you're in Lagos, any part of the world, just let us know where you're watching from. Okay. All right. So we're still talking about infertility. Um, Next thing we'll be looking at is the place of IVF in regards to infertility, treatment. So we've talked about infertility, we've talked about the possible causes, who to blame. Everybody has, almost an equal amount of blame. But when you want to manage it, what does where is IVF's place in the management of infertility?
Okay, assisted reproduction is includes all forms of treatment of infertility in which there is external or laboratory handling of both the female sex cell and the male sex cell. That's the standard definition of, or the generally accepted definition of assisted reproduction. IVF is recognized as the most effective treatment of infertility. In that, even in the other forms of treatment of infertility, there is no guarantee. You know, there is no guarantee. That is not to say that there is a guarantee in IVF, but IVF has recorded, shown to have a better efficacy than other forms of treatment. And it is one mode of treatment that can be adopted in most of the causes of infertility, even in the male factor infertility. In fact, the mainstay for management of male factor for me, it's IVF and other forms of assisted reproduction. Even ovulatory dysfunction, in which many people would say that the mainstay of treatment is ovulation induction, timed intercourse, and the use of various drugs for treatments for infertility. But IVF still shows that it's more efficacious than so many of the modalities of treatment. In fact, if there is tuber problems or you know there is that one, there is an absolute, that one becomes tuber damage becomes an absolute indication for assisted reproduction. And just like I said, in all forms of causes of, or in all forms of cases of infertility, assisted reproduction has shown to be very, very effective. So, but I would also want to add that in our environment there are many places in which the services of assisted reproduction or IVF is done, include especially in our own hospital, which is the Limi Hospital. But I would quickly want to say, or want to advise our viewers that you know the best place to seek treatment for infertility is the best place, is the place you see that you get the best management of the resulting pregnancy. What do I mean by that? I would advise that if you are seeking treatment for infertility, it's most wise for you to seek treatment for infertility where the pregnancy will be properly managed. And that's one of the things Living Hospital offers. We do not only, we don't stop at going through the process of treatment of infertility with you, but we still continue to continue the journey with you as you carry the pregnancy until we ensure that you go home with a live baby. That's one assurance you get.
People would ask, or one would ask, why is infertility becoming very common? Is it that the same issues that almost everyone is passing through the same, risk factor?
Or even your stress, the way you mentioned stress,
Yes.
the increasing stress in Nigeria.
Yes, of course, we're going through stress.
Okay. Um, yes, there is. Everybody I've observed. Everybody that is in the business of management of infertility in our environment would agree with me that in the past decade there's an increase. I would not precisely say what could account for that because I haven't done a study to show what would really account for that. But if you look at the risk factors for infertility, you can find some things that one may want to attribute to the rising incidence or rising cases of infertility in our environment. Number one, with the increased societal permissivity and uh, our sexual behavior moving from what it used to be to what we see in this our contemporary times. So that increases the risk of infections and all that. And you know, those days we are, you
We're
know,
more
we
conservative.
are more conservative, and people we are talking about, safe sex and the use of, condoms and barrier methods of contraception. I think the news is going down now, so we are beginning to see more cases of pelvic infections
Yes.
and sexually transmitted infections. I think that's one. And then some habits or some lifestyle factors that contribute to to the etiology of infertility are on the increase, like alcohol consumption and smoking in both males and females. These are some of the risk factors that I think with their increase in the society, we are not surprised that cases of infertility are on the increase.
Um, so are we saying that we can prevent infertility with what you said? Can we prevent it?
Yeah, a good number of the cases, or majority of, if you look at the risk factors, infertility, some forms or some causes of infertility are totally preventable. Like I've mentioned,
Infection.
with what I just mentioned, pelvic infections, sexually transmitted infections, some good lifestyle modifications would, like, being, somebody, there was those days of in prevention of HIV/AIDS. We'll talk about the ABC of prevention, which is abstinence, being faithful, and the use of condoms. Also prevents infertility indirectly by preventing sexually transmitted infections and uh, and other pelvic infections. And then also some stopping alcohol, quitting smoking, and you know better management of the medical conditions. I think that's another place where Limi Hospital comes in handy. We've seen people presenting to the Limi Hospital with primarily coming for infertility, and in evaluating them we'll find out that apart from what they think is the problem, but what is causing the problem is medical conditions, and we have physicians in-house, a good number of them, in which you, like hyperthyroidism, which you just asked me about. We've had cases where
It was managed
which
and
was
conceived.
managed, and the women even conceived naturally, not needing the
IVF
IVF,
that they
which we
gave.
so proper management of the medical conditions that are associated with infertility prevents infertility as well. And then seeking help on time
Time.
is also a good way to prevent infertility. Remember, I had to list conditions or situations in which the couple is advised to seek help even before 12 months. The definition of the WHO definition of infertility notwithstanding. So infertility is actually preventable. And then one would also say, what is the place of premarital fertility assessment in preventing infertility? But I think that's a whole topic where most people would want to wait. But one of these days, I think in our Instagram live, we may want to talk about the place of premarital medical and fertility assessments or premarital evaluations or those tests that people would want to do before marriage. Mm. So some of the causes of infertility are preventable. Even didn't even some of the infections like mumps infections, some viral infections that affect the genitals which are preventable by vaccination, can also indirectly prevent infertility.
That's why we emphasize on people being properly vaccinated, especially for moms that would cause, can cause complications affecting the testicles and the ovaries as well.
Yeah.
Okay. So, is it safe to say that, or is it possible to say that infertility can be inherited? Some people might say that. Don't laugh. There's people that would say that, oh, my mother took time before she gave birth to me, so that is why I haven't given birth after this long period of time. Is it inherited?
I want to let me say that infertility in itself, as it is, cannot be said to be a hereditary disorder, an inherited disorder, or an inherited disease. But the thing is this: there are some causes of infertility that can be genetically passed on to generations, like some of the hormonal problems like thyroidism, and then some of the genetic disorders that are inherited that can cause infertility. But infertility in itself won't be said to be inherited.
Okay. So when we look at you know, things that people would do concerning in vitro fertilization or assisted reproductive technology, um, what do you think about egg freezing? People freezing their eggs to use them at a later time, or
Okay. Yeah, yeah. It's part of the general procedure for, in vitro fertilization, assisted reproduction generally. It's part of it. The thing is this, there are some conditions in which even the caregiver, there are some conditions in which we can advise that the eggs be retrieved and frozen for embryo transfer to take place some other time. Like if in the process of stimulating a woman or even at retrieval, we find out that there is an increased risk of one of the complications of assisted reproduction, which is ovarian hyperstimulation. We freeze and transfer at a later date. That's just an example. And then, well, there are some other situations in which the guests or the clients themselves wouldn't want the embryo transfer to take place. And in some of the cycles we have done, we have retrieved and had embryos more than we would want to transfer. And the couples, being informed can say, what does it take for us to freeze and then, use at a later date? So, freezing is an integral part of the service and it's also available in our hospitals here.
so you can freeze your eggs. Yes, and if you're interested in that, we can do that for you. We offer those services, and the others can also store sperm as well.
Yes.
Um, um, Someone is asking, why am I not responding to drugs for ovarian stimulation?
Okay, there are some factors that would make a client or a patient not respond to drugs used for ovarian stimulation. Number one is age of the patient, and that's why sometimes we may advise you after evaluation for donor egg use. Those are some of the if you notice that there is a high chance that you might not respond adequately or you'll be a very poor responder to ovulation stimulation, controlled ovarian hyperstimulation drugs, we may advise for the use of donor egg. And then, like I said, one of those situations is age. You know, the older, as from 40 and above, you there may be reduced chances of getting a proper response even when the correct ovulation stimulation drugs have been used, and then or ovarian stimulation drugs have been used. Then the dosing of the drugs too, you know the body mass index of the patient should be taken into consideration, and even the weight, the absolute weight itself. Some people may not even want to use body mass index. Some may use the weight of the patient. So the weight should be, and then in a situation in which the woman has had IVF prior to presenting to the facility, it will not be and if she had an IVF and had poor ovarian response, it will not be advisable to use the same dose. If you still want to use the same drugs, it's not advisable. One is not likely to get a good result if the person uses. So these are some of the few situations in which the one may respond poorly to ovarian stimulation drugs.
So can birth controls, when people take birth controls, can it cause infertility?
I had to, why I had to laugh because uh, we absolutely defined infertility. Infertility comes in a
Yeah,
desirous couple,
environment.
not a couple that is not desirous of pregnancy, and they say 1 year you cannot declare them infertile. Mm. So remember in the definition of infertility, I said I stated clearly that that adequate. I stated clearly that it requires adequate sexual exposure for a period of 12 months. So, adequate unprotected. Remember the key word unprotected. So, if a couple is on birth control, any of the birth control or family planning methods, they cannot be considered to be infertile. But however, I have personally have come across a case in which a couple was coming for infertility, and what was found might sound so funny, but it was actually found. It was a forgotten intrauterine contraceptive device in which the woman was using for birth control prior to contracting that marriage. So, but that is not to say that a couple that is on family planning is considered to be infertile. No.
So you have that kind of misconception. I hope been able to
Help.
sensitize you and help with that. But others will also ask, after using some form of contraception for a certain period of time and stopping, can that still affect fertility?
Yes, some methods of family planning, fertility doesn't return fully immediately after stop. But most of the ones used in, you know, nowadays, most of them, fertility returns almost immediately.
Um, those that are still joining in, thank you for coming. Thank you for joining. We're still talking about infertility. Please keep your questions coming. So we have a question. What are my options if I decide not to use my stored embryos?
if a client has a stored embryo and
Doesn't want
is
to use
coming for fertility treatment and doesn't want to use it, that just practically means we'll have to start the process of
it.
getting
Another.
another set of embryos, which one would the client would have to go through
The
the
same
whole
instruction.
IVF process again.
Maybe they feel the one they kept is really old. They want to use a fresh one. So you have to go through the same process of.
And it doesn't get old. It's frozen, which tells you that it is arrested at a particular
Particular
stage
stage.
of development.
Okay. So keep your questions coming. Thank you for joining us. Thank you. Still Limi Hospital.
Let me also chip in something that in advanced ART studies or advanced infertility management, we do not just talk about embryos as it is or even the sex cells as they are. We talk about quality, because there are detailed and micro analysis or studies of these embryos that are produced. So one thing we try to do here is the quality of the embryos we select to freeze or to stop. I don't think they will fall into the class that one wouldn't want to use. And then even some other uh, you know, situations in which there has been some genetic analysis of the embryo.
Embryos and you've
One,
selected the
you select,
best.
and then the best have been selected and stored. And a PGD was done, and one wouldn't want to use such an embryo. I don't think it's advisable if the quality of the embryo was, put into consideration.
Okay. Another question. I haven't had another child after my first child. Does that mean I'm now infertile?
Okay. We missed the that part when we
Because
were starting, because I think uh, this person didn't may not have but see, there are two forms. If you check the definition I gave, which is the generally accepted definition of infertility, if you check the definition I gave, one can understand that even if you've had a child before and you are desirous of another pregnancy and you stay 1 year with adequate sexual exposure and you are not having another child, it's infertile. In fact, that is what we call secondary infertility.
after.
Although the definitions, that division of primary and secondary infertility doesn't really hold water these days in the management of the patient itself. So it doesn't really mean much. So even if one has had a child before and meets the criteria given by that definition, the person still needs to seek medical help or treatment for his or her fertility problem.
So if you've not had a child after a long time, please seek help. We offer wide range of services at Limi Hospital. You can come to us, we evaluate you, and check if there's any medical condition that you developed after your first child that could be what is causing it. So we check and treat whatever it is. And if you see that there's nothing else, and IVF would be the option to offer you that. And we've had so many successful, stories. We've had so many IVF babies, and we see them for follow-ups when they come for their vaccinations. We are so happy excited when we meet our IVF babies. So that's one thing that I know that you can get very well at the hospital, because we follow you from the point of entry till everything has been completely done and done well. Okay. So any more questions? More questions? Okay. Um, Another thing that one might also consider uh, something that most women would think can cause infertility. For example, fibroid, very common amongst black women, and our race
Okay,
already gives us a risk
okay,
factor to
yeah,
it.
yeah, yeah. I mentioned,
The
the
environment.
environment. Yes, a healthy, receptive, uterine environment, and intentionally, when I mentioned endometriosis, adenomyosis, I intentionally avoided mentioning uterine fibroid. The truth is, uterine fibroid and infertility do not have a direct cause and effect relationship. That is to say, uterine fibroid in itself does not cause infertility, but there are conditions or situations in which uterine fibroid is associated with what? Infertility, depending on the site and you know, the size and its effect on the internal uterine environment or the endometrial cavity itself. Then, let me also say that some in a situation where a woman comes in for infertility and after evaluation, uterine fibroid is the only thing that is found. In fact, studies and write-ups from authorities and professionals have shown that there is improved or increased chances of conception after removal of the fibroid. But that is not to say that it's a direct cause of infertility because, of course, you have so many women that are pregnant or have had children with fibroids. Mhm.
There's a lot of women coming complaining, asking, is that why I haven't conceived? Because I have fibroid. You know, sometimes they you just feel that that is the
And that is
causing
even
factor.
more, even those that had success stories. That what you just said is even more in those that have had success stories with fibroids. They tell the other women, ah, I came for infertility. They found fibroid. Immediately they removed the fibroid. I conceived. And I think that's the reason, that may have been the reason why the person asked the question. So we just have to note that it doesn't have a direct cause and effect relationship. But in certain situations in which it's the only thing that is found, chances of conception is increased if it is properly removed. And not just removed because the myectomy, which is the surgical removal of the fibroid itself, has its own risk, and it is still better to do it where it is properly done, and we also have a good outcome. We've had good stories and good outcomes with management of pelvic tumors, fibroids, and the rest of them.
Okay, so someone is asking about the vaccination for moms. Um, yes, the one that is taken uh, um, by children.
Oh, yes,
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 that is the vaccination for moms.
yes,
Yes, we
yes.
always
Meso
emphasize
MMR.
MMR, measles, mumps, rubella. So we always emphasize that you make sure your children's vaccinations are up to date. You make sure they come, you bring them to vaccinate them. You have their card as well, so that because vaccination helps the symptoms to be milder if they eventually get it. Someone's asking, is IVF painful? How long is the IVF process from start to finish?
Yes, IVF um, is not painful. That would be my response at first. Just an impulsive response because actually, if you look at the process, it's not painful. It just involves like taking some injections or some drugs and then coming for ultrasound scan. An ultrasound scan anywhere in the world is known not to be painful. The only thing that may even be painful could be, the retrieval, in which some anesthesia is used. So I can assure you, If I may not vouch for other places, but our own IVF process can never be painful, please. And then, there's a second question: how long does it take? It depends on the protocol that your gynecologist or the team decides to use for you, and the choice of protocol depends on some of the results that is found in your preliminary evaluation, but most of them will take a month or less. Almost all will take a month or less.
So we should also note that in Limi Hospital we practice patient-centered care. So every care we give you is based on you as an individual, not on another person.
Yeah.
So we focus on you, your symptoms, your comorbidities, all the other medical conditions you have. So it might not be the same for another person. So one person might have like 6 months duration, yours might be 1 month. So we follow individuals, according to their own specific features. Um, Another question: is there anything that could negatively impact IVF success? That's a good question.
That's a good
That's a
one.
good question.
That's a good one. I'm talking about the success of IVF. Um, Generally, one would say general reports show that an average of 25% success, but so many centers, both in Nigeria and outside the world, and even Limi, have reported higher success rates. And then there are some factors, of course. IVF is a treatment process. There are some factors that can, negatively impact. In condition, depending on the reason for the IVF itself, the indication for the IVF process itself can even impact negatively on the success. Like in a situation where the patient has endometriosis and is of advanced age, and then some other medical conditions that have been shown difficulty in its management. And then remember the question about poor response.
Yes.
When there is poor response to ovarian stimulation drugs, and then when there is a high chance of developing or one of the complications like ovarian hyperstimulation syndrome. Those are the conditions in which when a patient shows signs of this, those are some of the conditions that can impact negatively on the success of IVF. But there are measures to still improve the chances of success in these conditions, in which we pay detailed attention to in the services we render. So remember what you said: the care we give is centered and tailored to your individual fertility needs.
Another question: what are the side effects of IVF?
People like talking about side effects, but me, why would we always talk about the bad ones? Why don't we talk about the good effects of IVF, which is a live baby? So I start. One of the side effects of IVF is
Carrying your baby.
having a live baby.
Going home with your
That's
baby.
on a lighter mode. Okay, so there are some other side effects. Like I've talked about ovarian hyperstimulation syndrome, which is one of the most dreaded of them, and then some other conditions like development of resistant megalocystic ovaries, higher order multiple pregnancies like quadruplets, septuplets. Those are some of the side effects of IVF. And then some people react to some of the drugs that may be used in the process. And then even in the process of retrieval itself, there are some anesthetic complications and some of the few complications that may be associated with the process itself, the procedure itself.
So, are there any restrictions while a patient is undergoing IVF? Is there something the patient should not do? Is there something they should do? Are there food that they should not eat?
Yeah, there may be a few restrictions, especially during the time of controlled ovarian hyperstimulation before retrieval, and the early times after embryo transfer. There may be restrictions, and those restrictions are mainly related more to activity and drug use, alcohol use, smoking. There are lifestyle restrictions which your gynecologist or your physician will discuss and communicate with you. And these restrictions most times, like you said, are individualized.
So we now know that it's based on individuals. Okay. Is there any other question? Is there anyone just joining us now? Welcome. We're talking about infertility. Someone just asked, can I choose my baby's sex during IVF?
Sex selection is one of those other services I mentioned that are part of the assisted reproductive technology, ART process itself. Sex selections. Yes, there is room for that in Limi Hospital. We do sex selection.
Person wants,
Yes.
if you want a male child.
And that's a process that if you come for, we'll tell you about the various processes and how it will be done and the chances of success, which I can assure you is very, very high.
Right. Okay, so if you're joining us, this is Limi Hospital. My name is Dr.Obi, and with me is Dr.Ogoke, a consultant gynecologist and obstetrician, and we've been talking about infertility and IVF as a form of management for it.
Thank you.
Yeah, so any more questions? Someone's asking, will I need IVF for all future pregnancies after a previous IVF?
That's a very good question. This actually depends on the reason for which the
Like the
IVF
first
is
one.
done. If the like in some cases in which the reason for the IVF is an absolute indication, like I mentioned tubal damage, that particular person would need IVF for subsequent pregnancies. But in cases of ovulatory dysfunctions, that means person may be lucky conceiving naturally after IVF. So this totally depends on the reason for the first IVF.
Thank you all. Thank you all. It's been amazing. It's been wonderful, answering your questions and talking about infertility. Thank you so much for coming on live. Thank you. Please tell your friends, tell a friend. We're here every Friday at 6 p.m. We're talking about major health issues that affect each and every one of us. We offer good, broad spectrum of treatments at Limi Hospital. We have three different branches here. So we're a multi-specialty hospital. We have our cardiovascular center. We are good in surgery, obstetrics, and gynecology. We have our pediatric hospital where we have pediatric cardiologists, neurologists. If you have anything at all, yes, pediatric surgeon, any issue at all, there's no issue, there's no specialty that Limi Hospital does not have. So thank you all for joining me. See you same place, same time next week. Thank you.